Chapter 4. Cooking Up Trouble. Typhoid in New York, 1906. Oh, cook, I just had to come and talk to you about this evening's dinner. Mrs. Warren was rarely seen in the kitchen of her family's grand rented summer house at Oyster Bay, Long Island. And when she did appear, the cook noticed that it always caused a commotion among the staff. Not surprisingly, really, Mary had worked for many wealthy families over the years, and in her experience, the lady of the house generally came to the kitchen only to complain. She'd been cooking for the Warren family in this fashionable summer resort town for almost 3 weeks now, so she was probably overdue for a scolding. The clams she'd served tonight, had they smelled a little off? Rich New York City folks could be terribly sensitive. She knew that. Mary hoped she wasn't going to be fired. It had been hard enough finding this job, and she didn't look forward to the thought of pounding the pavement to look for work again so soon. But to her relief, she realized Mrs. Warren had come to the kitchen to praise her. The clams were so tender, sublime, and the dessert so refreshing. Just the thing for a warm summer evening. My daughters were in heaven. What do you call the dessert? It's peach marmalade, ma'am. Very fashionable just now, and all the best New York restaurants are serving it, they say. Peach marmalade. How wonderful. You must make it for us again. I'm very pleased with you, cook, and I intend to keep you on in the fall. I imagine that suits you? Yes, ma'am. Thank you, ma'am. Fine. Good evening, Mary. A shameful disease. The Warners' cook, Mary Mallon, went to bed that night, glad to have a steady job for the fall. She would be happily pleased her employer with more special dessert, a peach pie perhaps, but there would be no more elaborate meals cooked for the Warren family that summer. A few days later, on August 27, 1906, the household awoke in turmoil. Margaret, one of the Warners' daughters, was seriously ill. Margaret had gone to bed early, complaining of a bad headache. By morning, it was worse, and soon she was doubled over with stomach cramps. As the day wore on, Margaret developed a violent cough, and her mother noticed that the girl's skin was hot and dry, almost burning to the touch. That afternoon, one of the maids collapsed and had to be sent to bed. Then the gardener dropped over his rake, and he too had to be helped into bed. By the evening, the Warners' second daughter had joined her sister in the sick room. Finally, Mrs. Warner herself was stricken. More than half of the members of the household were now fighting for their lives. Doctors were called in, first from nearby towns, then specialists from New York City. Private nurses in white uniforms whisked down the corridors, carrying cups of broth on silver trays. There were grave faces and whispered conferences between the medical men. Finally, the diagnosis was delivered. Typhoid fever. Typhoid. It was unthinkable. Wealthy New York bankers' wives and daughters were not supposed to get typhoid, not in 1906. Not in fashionable resort towns like Oyster Bay, Long Island. Typhoid was a disease of the poor. It meant you didn't have proper standards of hygiene in your home. Immigrants, laborers, servants, those were the people who fell ill with typhoid, not the rich and privileged. Outrage. Charles Warner demanded an explanation from the owner of the summer house, George Thompson. Thompson was worried. If he couldn't find the source of the disease, his luxury summer house might get a bad reputation. And then how would he rent it out next year? If people in New York heard that typhoid was running rampant on Oyster Bay, it could hurt the whole town. And he had 4 other houses to rent each summer. This mystery needed to be cleared up quickly and discreetly. Thompson started asking around for an investigator with a scientific or medical background. A few weeks later, Thompson found just the man for the job, George Sofer. George designed and managed sewer systems for a living, so he knew a lot about how diseases could be spread through water contaminated by human waste. He had made a name for himself as an investigator by tracking down the source of typhoid epidemic in Ithaca, New York, a few years earlier. Now he packed his bags for Oyster Bay. The first thing George did was check the house's plumbing. He put colored dye in Warren's toilet and flushed it to see if it would show up in the home's drinking water. The water from the taps remained clear and colorless. Next, he looked for leaks in the home's cesspool where the water collected. It was fine. Contaminated milk was a frequent source of typhoid, yet the dairy that supplied the Warren family was spotlessly clean. One by one, George eliminated the usual suspects for a typhoid outbreak. Finding that the source wasn't going to be as easy as he had hoped, George interviewed all the family members, trying to sniff out something unusual that might have happened in the days leading up to the outbreak. Someone recalled they'd all eaten clams bought from a local woman on the beach. George checked, but none of the clam sellers, other customers, had gotten sick. It wasn't a case of contaminated shellfish. Still, it made George wonder if something the family had eaten might have picked up contamination in the kitchen. He went to talk to the kitchen staff, and he heard something that made his ears perk up. The family's cook, hired just 3 weeks before everyone got sick, had recently quit. He asked more about the cook, an Irish woman whose specialty was a dessert of peaches and ice cream called peach mobile. Listening to the family sing the cook's praises, George realized that she could have passed the microbes to them when she handled the uncooked fruit. Now, a new cook hired. Family gets ill. New cook leaves suddenly without any explanation. It was highly suspicious behavior, in George's opinion. He asked for the cook's name. It's Mary Malone. Tracking the suspect. George headed straight back to New York City, where he stopped in at an employment agency that supplies the city's wealthiest household with servants. Do they have records for a cook by the name of Mary Malone? Indeed, they did. Working backwards through her employment history, George visited each of the families Mary Malone had cooked for. A disturbing pattern emerged. In every household in which she worked in the last 10 years, there had been an outbreak of typhoid fever. Mind you, there wasn't a single exception. George wrote in his report about the case. George's detective work showed that Mary was linked to 22 cases of typhoid and 1 death, all in homes with no previous history of the disease. How could Mary have been ill and contagious with typhoid for 10 years? George began to wonder if Mary Malone was somehow able to pass on the typhoid infection to others without showing any symptoms of the disease herself. In 1906, a few doctors and epidemiologists were beginning to suspect that, in some cases, healthy people could transmit diseases. Today, they are called asymptomatic carriers. A German bacteriologist, Dr. Robert Koch, had recently published a scientific paper about a healthy carrier of typhoid. The carrier was a woman who had come down with typhoid years before and had made full recovery. When the doctor examined her, he found to his surprise that her feces, urine, and blood were still full of active typhoid bacteria. George Sofer knew the only way to be sure if Mary was a healthy carrier was to test her urine and feces to see if they contained the Salmonella typhi bacteria that causes typhoid. But he had to find her first. Months went by with no leads. Then, in the spring of 1907, George happened to hear about a family living in fashionable Park Avenue in New York City whose daughter was terribly ill with typhoid. He hurried over and soon learned that the family had recently hired a new cook. Yes, her name was Mary. Why, yes, Mary Malone. Did George know her? George probably ran all the way to the kitchen. He found the exclusive Mary Malone at last. But the interview he'd looked forward to for so long didn't go well. In his eagerness to make an important scientific discovery, he overlooked the fact that he was dealing with a human being with emotions, not just a walking collection of typhoid germs. When a strange man burst into her kitchen and demanded that she give him samples of her blood, feces, and urine, Mary was insulted and horrified. She did what any self-respecting cook would do. She grabbed the nearest weapon, a sharp carving fork, and chased the man out. The doctor's plague. Today, every kid learns about the importance of hand washing. Clean hands are one of the most effective ways of preventing the transmission of communicable diseases. But not too long ago, even doctors didn't bother to wash their hands. When one doctor pointed out that clean hands seemed to help keep patients from dying, his colleagues felt so insulted that they ran him out of the profession. In 1847, Ignatius Samuelis was working at the mortality clinic in the Vienna General Hospital in Austria. At the time, 10% of women who came to the hospital to give birth died from bacteria infection called puerperal fever. Dr. Seinswell suspected that doctors were passing the infection from woman to woman. And he asked them to try washing their hands in water and bleach before each delivery. When they did, rates of puerperal fever at the hospital dropped to less than 2%. Hand washing worked, but Seinswell couldn't explain why. When he presented his findings and argued that all doctors should wash their hands, the hospital fired him. He was forced to leave Vienna and had difficulty finding work as a doctor ever again. 20 years later, Louis Pasteur proved that microscopic organisms called diseases, and suddenly Samuelis' insistence on hand washing began to seem more reasonable. In the 1880s, when a British surgeon called Joseph Lester started sterilizing surgical instruments, many more people survived operations. Doctors were cleaning up their act.